Hi everybody and welcome to today's webinar on coronavirus at work. As you may have seen, we've been inundated with registrations for this webinar and we've been asking you to send your questions in to us in advance. We will do our best over the next hour to answer as many of them as we can, but if we don't get to them all, or if we think they need a little bit of extra research, we'll post written answers to you afterwards. We also think that this is a great opportunity for you to share with us some of the experiences you're having in your workplaces with your members and how you're being affected so that we can consider the advice that we give you. So please post any experiences that you're having in the chat panel that's on the right-hand side of the webinar screen. We will also, at the end of the webinar, be giving you a place where you can further share your stories and share your experiences. So stay tuned and we'll let you know how you can find out ways to do that. So I'll hand over to my colleague, Shelly Asquith, our Health, Safety and Wellbeing Policy Officer.
Good afternoon, everyone. Thank you for joining us for this TUC webinar. We're now just going to post a link to the TUC guidance for unions, which was published last week on COVID-19. For any of you who may not yet have seen it, you may want to refer to it as we go through if there's anything more specific in there in terms of what we're going to be referring to. Throughout the webinar, I will be doing my best to explain any terms or jargon that we're using, but please, if there is anything that we say that isn't clear, post it in the comments and we'll do our best to explain it. The webinar is going to be structured by the questions that you've submitted. As Anna said, not all of them will be answered because there's been so many. But first, I'm just going to do a short overview of what we know and then go through some of those questions. So when it comes to COVID-19 and work, what do we already know? The novel coronavirus, or COVID-19 as it's been named, is a serious public health crisis affecting every corner of the world right now and working life in a way not seen for a generation. As the rate of infections and the rate of deaths rise, the response is changing rapidly, with new measures speculated and announced by governments and organisations on a daily basis. The best case scenario for workers in the UK is that they have access to full pay while they're sick or in isolation, they have sympathetic bosses if they need time off, and they can access appropriate healthcare and other necessities. But we know this is just not the case for millions of workers. And our role as trade unionists is to work collectively to get the best possible outcomes for our members, to protect their health and the health of the public, as well as to safeguard jobs that are at risk. There are a number of ways we can do that, whether by negotiating with management or organising industrially. So onto the presentation. Coronavirus is a group of viruses which normally cause mild illness, with symptoms generally presenting as similar to a common cold, so especially a cough, shortness of breath, and a temperature. Novel coronavirus is the term used for strains not previously identified in humans. The latest strain, which was first identified in December 2019 in China, has now formally been named COVID-19. A pandemic is an outbreak that affects hundreds of millions of people worldwide, leading to a large proportion of them becoming ill. Pandemics occur when a virus with very different features emerges. And because it is new, people have little or no immunity to it. Now, the World Health Organization last week has said that COVID-19 is officially a pandemic. The main way the virus spreads is by contamination when someone carrying the virus coughs or sneezes. That's the main way, at least. Viral droplets that come out of the mouth can travel up to 6 meters, making person-to-person transmission particularly likely. Current advice recommends that anyone who has recently visited certain countries or certain areas in countries or has had recent contact with somebody who should isolate themselves, or if you have symptoms of COVID-19 or indeed have tested positively with it. There is currently no vaccine or medication for the virus. Scientists are trying to produce one, but it is unlikely to be available before the virus has already spread globally. Now, when it comes to hygiene in the workplace, you'd have seen these adverts, washing your hands, do it for at least 20 seconds at a time, do it more regularly. We're also calling on employers to clean surfaces more often, and where COVID-19 has been identified, to undergo deep cleans of those workplaces. We should also be asking employers to do more regular cleaning of shared utilities, so things like door handles, printers, kettles, anything that is touched by multiple members of the workforce. We're also going to share now a link to how to best clean your smartphone, because obviously we're being told not to touch our faces too often, and that's something that's coming into contact with our faces. And also for those of you like me who are glasses wearers, or indeed if you're wearing goggles for your work, these are things that are coming on and off all the time. So best way to clean those is in that link as well. Now, when it comes to self-isolation, workers should be in isolation if they meet any of these categories, as you see on the slide. NHS guidance has recently changed, and isolation periods are now recommended as 7 days rather than 14. So keep a lookout for those kind of changing guidelines and recommendations. Our own guidance needs to be updated as a result of that change last week. Sick pay. So though the government has made emergency changes, which mean workers can claim statutory sick pay from day 1 of an illness instead of day 4, nearly 2 million workers remain ineligible to sick pay because of the payment threshold. It's also only £13 a day, which is a wage no worker can realistically sustain themselves on. So there's huge downfalls and shortfalls when it comes to statutory sick pay. Many workers will have occupational sick pay in their contracts, which will generally be more generous than the statutory rate. And unions need to be demanding that this applies even when a worker is in isolation without any symptoms. When it comes to obtaining a fit note, NHS 111 line will now provide certifications via email, and this should be accepted by employers. So that's one demand that unions can be making. There's been a lot of questions about personal protective equipment, or PPE, as we call it. There's a lot of confusion around this about whether everyone should be wearing a mask or gloves to prevent contamination. There's no evidence that outside of healthcare situations, the general use of face masks has a huge effect on protecting people or reducing the speed of the pandemic's development. But new research is being done constantly on this. There's more information specifically in the guide. Gloves don't prevent infection, as people will be touching their skin with the gloves and touching other surfaces or people. And there's also issues around latex gloves in terms of how they can be disposed, and they can also produce a lot of allergic reactions. So check the guidance for more information on that, but be very wary around the kind of general advice of everybody should be wearing masks. There are workplaces, however, that do need extra precautions. In certain public-facing workplaces, specific risk assessments should be carried out in line with the Control of Substances Hazardous to Health Regulations 2002, or known as COSH. And for health workers dealing with COVID-19 patients, so nurses, doctors, and other health workers, there are specific items of PPE required. Union reps should look out for the certification mark on those items and be wary of any companies that might be approaching your employers trying to flog them substandard masks and gloves that don't meet those certain standards. So watch out for that. And the details of those kind of PPEs that healthcare workers should be wearing are in the guidance, as I say. And there are other measures employers should be taking in order to protect workers, besides access to sick pay and the equipment. Higher levels of cleanliness in the workplace should be expected, and as well as access to relevant and correct information. There's been a bit of a fake news storm going on, so there's a duty for employers to provide the right information to workers. There's been questions about air conditioning I've seen in the comments, and it's recommended this is not switched off. This will differ workplace to workplace, but I've put more info on this in the guidance again. It's recommended that any worker being required to travel for work should have those commitments cancelled where possible. And this is because of the uncertainty of various government new border policies that are being introduced and the risk of workers being stranded abroad. Something came in from Steve, who says he's a National Union journalist rep at the Financial Times. And he said, we're also asking for risk assessments of home working arrangements, including ergonomics and equipment, which I think is really good advice. And people's web connections and things like this should be assessed as well if employers are asking you to work from home. Any policy at all, indeed, being drawn up by an employer should have the full consultation and the full backing of the union. So make sure you're being included in those discussions. Before I move on to the questions, these are the demands that the TUC is making on a national level to both government and employers. We are calling for urgent action to level up statutory sick pay. As I said before, for anybody in financial hardship, it is not enough. Or anybody choosing to go to work when they're unwell, they're putting themselves at risk for the fact that statutory sick pay is not enough to live on. So we need government to urgently increase the rate, and we're asking it to be increased to the living wage. We want the government to immediately establish a task force, including trade unions, so that we can work together with employers and the government agencies to safeguard jobs and industries that are most at risk of disruption. We're seeing a lot of serious risks of certain business going bust, and a lot of workers will understandably be very concerned about their own livelihoods. We also want to ensure anyone having to miss work due to their children's school or nursery closing has access to paid parental leave. Again, we don't want anybody to be going without an income during these difficult and uncertain times. And in the next slide, here are 10 steps as well that we've put together, not exhaustive by any means, that union reps on the ground in workplaces can be taking. So ensuring that you're talking to the employer about getting full sick pay for all your workers, ensuring that you're including agency workers, and I'll come on to that later, in any of those policies, thinking about industrial action you can take, and also getting involved in the TUC's demands around sick pay. I'll expand on some more of those in the Q&A, but many are also referenced in more detail in that guidance which we shared with you at the beginning. So if there's been more comments, remember to scroll up to get that link to the guidance in the comment section. So moving on to some of the questions now.
So we've had loads of questions, which I can see even more coming in, and we'll try and answer as many as we can. So the first has come from a CWU rep. They ask, in the postal industry, we used to have PDAs for parcel and signed for items, etc. This PDA is passed from person to person. Could the virus live on a PDA? If so, what precautions could be taken to minimise the possible spread of the virus?
Yes, so the virus could live on any hard object up to a certain amount of time, and I'm afraid how long it can live on an object, and just to clarify, the PDAs is personal, digital, I forget the name, but it's the thing you're handed when you sign for a delivery, etc. I'm sure CWU reps that are tuning in can clarify the initials to us in the comments. It can live on any hard object up to a certain amount of time, and I say a certain amount of time because how long is being disputed as new research is being done all the time. But some research has shown the virus living up to 72 hours on a hard object. And again, this is something that in our own guidance we need to update all the time because new research is being done. Now, Tesco has started to make it so that a driver operates the PDA up, its personal digital assistant. I've clarified it for myself. And union reps should ask the employer to make those allowances as reps have done at Tesco, so that this isn't having to be handed over to anybody. The driver can just do it themselves. Similarly, unions should be asking for this in jobs where you're asking people to sign something on an iPad or any other kind of similar device. Also, some good advice from a rep called Kieran in the comments, health and safety rep with the Shop Workers Union Usdaw. And he said shopping at infected homes is to be left outside. And we've heard of other companies allowing for deliveries to be left on the doorstep so that no contact has to be made with anybody who is either infected with COVID-19 or is perhaps isolating with symptoms or isolating because they've been in contact with somebody. So that's a good safeguard as well. So things can just be left on the doorstep and the person at home can be alerted that they're there. So definitely reps should be making that case to employers where that's not already being done.
So the next question we've had is, I'm looking for advice on refusal to take part in deep cleaning at a school over concerns to health.
So I'm not sure if this question has come in from somebody in a school who's employed as a cleaner or in another type of job. So I'll try and answer. Certainly, if you're asked to carry out a duty that is not within your job description, i.e. If you're not a cleaner, you can reasonably refuse, and you should speak to your union rep as a first port of call, as it's likely there will be colleagues who've been asked to do the same. So you won't be on your own in terms of making that refusal. And if your job is to clean the premises and you're concerned about cleaning an infected space, your employer should either be equipping you with the relevant personal protective equipment or making plans for a specialist service provider to carry it out. Now, if you're not equipped properly, you should not be carrying out a deep clean on an area, a workplace that has been proven to be infected with COVID-19. You are putting yourself at risk, and your employer should not be putting you in that position. What exactly those PPEs are is detailed in the guidance. They're very specific, and they're generally for people who are carrying out those types of deep cleans or are coming into regular contact with people who are infected, for example, health workers. So either way, I would say the union needs to make very, very clear to the employer that no worker should be carrying out work that is either not in their contract or could be putting themselves or others at risk.
Thanks, Shelley. So Bill, who's a PCS rep at the Equality and Human Rights Commission, has asked, or he said, consensus from members is that the choice to work from home should lie with the members, not with management. I'm interested in whether we can force the employer's hand on this.
So it's great because it sounds like you've already established a consensus from members, and I'm guessing that you've already held a branch meeting on the response to COVID-19 already, which is good advice for other branches if you haven't done so yet. Even if it means doing a kind of online meeting or an email consultation with members, it's a very good idea to kind of get that feedback, and if you can, come to a consensus of feeling around what the employer's response should be, or indeed what your response should be as workers collectively. It's a good question because, yes, ultimately, in certain cases, union members may need to take things into their own hands. The UCU, University Colleges Union, for example, has now formally called on universities to close and for work which can be done online or from home to be done so. This is partly, of course, because the number of people in a lecture or a seminar and the number of students that are present is often very large. And so there's a particular risk, the larger the number of people in the room, of spreading contamination. So there's a particular risk in universities that's been identified by the union. Some branches are also talking about using the Health and Safety Act to refuse to carry out duties, and we will post specific advice on that after the webinar. It's quite technical, and we want to make sure people are getting things right. But any union could make the same demand on an employer or organise industrially for a work from home policy, as has been done by Italian trade unions, for example. It's also worth checking what's in your contract. So, for example, you might already have a right to work from home at a manager's discretion written into your contract or in your staff handbook. So consult with that and exercise that if it's relevant and if it's available to you. In government departments, though, which is where this member is from, remember that not all workers can work from home, and that's not just for government departments, that's for lots of workplaces. For example, the cleaners, the security. So the union should be making sure that any forcing of the employer's hands, as Bill put it, doesn't penalise anyone financially due to the nature of their work. So if you're able to work from home and be on full pay, fantastic. But if a cleaner cannot carry out their job, make those demands that they should also be on full pay, so that nobody's there's an equality of treatment in the workplace.
Great, thanks. So the next question is from a Unite rep who has said that they represent mainly speech and language therapists who see people who are over 65. So that we work with a high-risk group, and while carrying out swallow assessments, inevitably people cough and splutter. So they're seeking advice for educators on working with young people who could potentially also be at risk.
Okay, so I've grouped these two together because both older people and younger people with underlying health conditions are both high-risk groups. Older people without any underlying health conditions, that is. So the government has now said that very soon they're going to be asking over 70s to stay indoors and to isolate for potentially up to 4 months. Now, this poses a serious question for workers like yourself, speech and language therapists, who would ordinarily do visits with these people. If any of your members are unwell, they should avoid visits with those groups, especially. If they're unwell with COVID-19 symptoms, they should be isolating anyway. Similarly, if any clients or people that you work with are unwell, your employer should be made aware and you should not be being asked to see them. So ask your bosses to issue a note to all clients asking them to give warning if this is the case. People should be writing in to say, I'm too unwell, don't organise any visits for me. And that applies to lots of different industries and workforces as well. The bottom line is that no workers should be penalised for not putting their clients at risk. So if you need to take time off, then do so. It may be that certain personal protective equipment is appropriate for your members as well, particularly when you're talking about people coughing and spluttering. So If you're carrying out work with at-risk people who are unwell and it's essential work, your manager should consult with the NHS employers to find out the specifics of the PPE that should be made available to you. The National Institute for Health and Care Excellence guidelines state that face masks and eye protection must be worn where there is a risk of blood, bodily fluids, secretions or excretions splashing into the face and eyes. So you can use that to back you up. In the event that non-urgent services are suspended, the union should ask the employer to draw up a precautionary policy and push as much as possible to ensure that your members will receive full pay in any event. So that's if you're asked to isolate, that work is cancelled. In any other case, if a worker is suspended from work, that would be the norm. And I think we should be anticipating this happening for the types of work that you're delivering. For example, in the United States, most allied healthcare workers are now restricted from visiting care homes where you've got that older age community. And while I'm on the subject of older age groups, many unions do have active retired members branches. So it's definitely worth you reaching out and making contact with them, I think. There'll be a good first port of call to see what union members can do to support them while they're isolating. People have been talking about delivering mutual aid in the communities, for example, food deliveries, or just checking in with people to avoid them feeling isolated. So do contact those retired members branches.
So a question from another Unite rep who says that they are a baggage handler and that they need help as no one is flying at the moment. BA is in trouble and it's only the start.
Yeah, I saw it was reported last week that 2 BA baggage handlers had actually tested positive for COVID-19 as well. I also know that British Airways has offered unpaid leave to its staff, which means many will really struggle financially if they do have to take time off. But a major concern is whether people will have jobs to go back to at all. We've been saying to the government that an urgent task force needs to be established that includes those government departments, the Department of Transport, for example, that includes big employers like British Airways and includes the trade unions that represent you. It's been done in other countries, but it's not been done here yet, and we're really pushing for that action. Unite the Union, which you're a member of, has been calling on the government for intervention, especially in relation to the situation with British Airways and other airlines, and has agreed demands with sister unions across Europe, and they include making contributions to cover workers' pay, the extension of loans to airlines and airports to assist in the retention of staff and the preservation of routes, and the temporary suspension of reduction in air passenger duty. So there are demands that the union reps can be making, but there's also demands that the union nationally can be making, and we need to get involved in voicing those as well.
Great, thanks, Shelley. Before we go on to the next question, it's just worth me saying it's great to see that you're still sending in lots and lots of questions to us. We're not going to be able to get to all of them within the hour, but we will do some research and post answers to any questions after the webinar on this site. We'll be posting them in the Ask a Question panel that's at the bottom of the screen. What's also great to see is that some of you are sharing links to arrangements within your workplace. So we can see that Derek, just a few chat boxes up, has said, posted the arrangements on COVID-19 related sick leave in the Home Office for people to view. So if any other viewers can also share things, if you're able to, please do, if you feel it would help any other people viewing the webinar.
What we'll also follow up with is our own guidance that we've published, but also all the relevant guidance that our member unions have published. So we've got a lot of you saying I'm from X union, Y union, and we'll follow up with specifics that they're doing, because obviously a lot of those sectoral guidelines differ from our generic advice to workers.
Yeah, absolutely. And some of the questions are, as we would expect, not just to do with health, safety and wellbeing. There are questions about pay, about employment rights, about equality issues. If we can't answer all of those today, we're considering doing a follow-up to this webinar within the next couple of weeks, where we'll have Shelley back again and some other colleagues from the TUC who specialise in those policy areas. So do please sending the questions in, because as well as helping us share experiences, it helps us to give the best advice to you in the workplaces to help your members. So we've had quite a few questions about how best to support agency staff. Should we be required to close? They're particularly precarious as they have no occupational sick pay or leave entitlement. What can we do?
So I think this is a really good question in terms of workplace solidarity with colleagues in different jobs and on different contracts, because a lot of people are concerned about their own well-being, their own access to sick pay or equipment, but being mindful of those other people in your workforce who might not necessarily have occupational sick pay and other benefits. So firstly, if the agency colleagues in your workplace are in a union, find out which union it is and reach out to them. If they're not, consider whether your own union may be able to assist in including them in any negotiations that you're making with the bosses, and encourage them to also join a union if they're not already in one. You can find information on TUC's website about which union would be the most relevant, depending on the kind of work that they are carrying out. Tom, who's a PCS rep at DEFRA, a government department, wrote in to suggest emergency committees of union reps who can pool resources of advice and support to non-unionised workers, which I think is a really good idea. This might be something that trades councils or particularly co-coordinating committees in specific workforces might be able to pull together and do. If you can, provide colleagues with the information as to what they are entitled to. So those agency workers who may not necessarily know that they're eligible for statutory sick pay, and provide that information to them if you can. And we'll go over again shortly what those rates are, who's eligible, who isn't eligible, and what you're entitled to if you're not eligible for statutory sick pay. Various agencies have actually already agreed to pay workers needing to isolate. So find out if they're employed by one of those agencies. Now, the GMB union have been doing a lot of work around this, and they've managed to get ISS and Sodexo as two examples to agree to paying workers full pay if they are in isolation. So you can point to a precedent here, it's not one of those agencies, and say, look, your competitors are paying people properly, you need to start doing the same. Although, having said that about ISS, ISS at Lewisham Hospital, which employs cleaners, COVID-19 cases were, some of the earliest cases confirmed were at Lewisham Hospital. The agency there has refused to pay its cleaners last month's salary, I believe, which has resulted in them walking out on strike last week. So don't necessarily quote ISS as the best example, but there are other workplaces where they have agreed to pay that full pay. If your employer is drawing up policies for the workforce around paid sick leave, self-isolation, and so on, ask them to include all the agency workers. They've also got the power over the agency that they contract. So, you know, they provide the agency with that money, with that ongoing contract of work. So your employer has pressure that they can put on that agency, or they can even release extra funds to cover any costs to do with sick pay if they wanted to. So bear that in mind.
Thanks, Shelley. It's great to see that a few of you have liked the idea of us doing a follow-up to this webinar within the next couple of weeks. Obviously, with this issue, things change daily, things change multiple times a day. So we will follow up on it, and we'll follow up with a webinar, but also with written answers as well, and give you an opportunity to share your experiences. A couple of people have been asked if we'll share the PowerPoint. Yeah, absolutely. If you signed up to the webinar, tomorrow you'll be sent a link to the recording that we'll put on YouTube, so you can re-watch it in your own time. And we'll also send you a link to the slides and to any other resources that we talk about through the webinar. We'll put those in the email that we'll send out to you tomorrow. Great. So the next question, also from a Unite Health and Safety rep, what is the situation for offshore workers?
So I think this is a particular concern because this is particularly quite isolated group of workers, and it's been confirmed as of this morning that an offshore worker on a platform in the North Sea, just north of Aberdeen, I believe, is now being quarantined because they are suspected of having COVID-19. Now, Oil and Gas UK have set up an emergency steering group and say that anyone who is tested positive for the virus will be removed by helicopter. But if a platform is put on lockdown over fears of contamination, you will all be brought inshore by boat. So measures are being put into place, but I think you should certainly be in touch with your union if you have any concerns that your concerns aren't being adequately met by management, or if there's certain equipment you think you should be having access to. And certainly if if people are in quarantine and are not being paid full pay. That's a demand that should be being made as well.
Great, thank you. So the next question, someone says, I would like to know where we stand as reps if managers are not sharing any information or briefing their reps on coronavirus.
Okay, so firstly, it's incredibly concerning if employers are not providing workers with even the basic information. And we can go back to the slide which sort of details the information that you should be receiving in terms of cleanliness, hygiene, and PPE. But firstly, you should make it very, very clear to your managers that there is an absolute duty of care from them, and make it clear to your HR department if you have one. And at the very least, they should be sharing information with employees from sources like Public Health England, the NHS, or the government, making sure that they're going to those legitimate sources of information for the relevant and correct advice. Some employers have started doing regular bulletins by email or by text to all employees with any news or relevant information. If you're used to having kind of all staff meetings in person, that might be something that employers are going to avoid doing. So you should be asking for that to be replaced with online information or written information, whatever is kind of relevant to your place of work. You should not be not getting any information because those meetings aren't happening. In one case that I want to kind of draw on, at a Royal Mail sorting office, somebody had tested positive for COVID-19 in that workforce. So their colleagues were rightly alarmed and concerned about their own health and safety going back into work. So the CWU, the Communication Workers Union, agreed with the employer that a medically qualified clinician would come in and brief the workforce to provide assurances and answer any questions that they had about the virus and about contamination and so on. And a deep clean took place, as you would expect. So it's worth pointing to these examples, I think, when you to your employer, and reminding them that if people fall ill, they will be even more short-staffed at the end of the day if they're not providing the right information, if they're not providing sick pay, and workers under pressure from presenteeism or for fear of being sacked or facing disciplinary are coming in while they're unwell, they're going to be contaminating the workforce further, and there's going to be even more people taking time off sick as a result. So just remind your bosses of those kind of consequences and their duty of care on you.
Great, thank you. Just worth pointing out a couple of the resources that have just been posted in the chat panel. Teresa has posted a really helpful link for those people who might have to sign up for universal credit, particularly with regard to coronavirus. And Hilda has posted a link to a hazards campaign leaflet that reminds us safety reps and safety committees regulations rights and which ones you can use in this situation. Really important for all safety reps in the workplace. So the same, another follow-up question from the same rep we had a few minutes ago. I said, if a member of .com has tested positive, then surely all drivers, pickers and managers associated with that department should be placed into quarantine for 14 days to be on the safe side. Is that right?
So in a word, yes, that is right. The NHS advice on this is now changed to 7 days, as I mentioned earlier. So that's something that we in our guidance need to be updating. But yes, if someone has been in close contact with someone else who's tested positive for COVID-19, within the last 7 days, they too should be self-isolating. So if the employer is not recommending they do so, then the workers should call NHS line 111 for advice, and if necessary, get the written confirmation that they can then provide to the employer to say that that is the measures that should be being taken. And yeah, thank you to Hilda for reminding us all of the health and safety reps in the workplace and the legal right we have to those. If you know your health and safety rep, then get in touch with them, because they will be being informed of any specific measures that should be being taken. And if you don't have a health and safety rep in your workplace, please consider becoming one.
Always good advice. So the next question actually covers quite a lot of the chats that we've had in the panel, and it concerns self-isolation and time off work. So the question says, I'm concerned that if I self-isolate, it will count against me in a capability review. I've already had time off this year when I was sick.
Okay, so this is a serious concern for a lot of people who if your employer has a particularly strict disciplinary and attendance management policy. Now, this is something that the TUC and the union movement is not satisfied with, regardless of the current public health crisis. Unions have already negotiated with a lot of employers for self-isolation or time off sick with COVID-19 symptoms. This period should not be included in any such policies. Particularly, a lot of employers in the transport and manufacturing industries have managed to negotiate this. And also, I think, given the government's allowances and emergency changes around the statutory sick pay policies, I think that gives a green light for employers to look at this the same as a very unique case that should be disregarded under those kind of normal workplace procedures. If this case has not yet been made by your union, be sure to make it, and be sure to kind of point to those examples in other workplaces where this is already happening, and remind the bosses that it's in everyone's interest. If workers don't feel afraid to take time off sick, to take time off in isolation, it's in their interest that those workers are not then infecting even more colleagues.
Great, that was really helpful, thank you. Something of a bit of a different subject now. There have been reports of racism towards certain communities in the wake of COVID-19. What can we do to support those affected?
Yeah, I've read about some really appalling and scary incidences of assaults here in the UK, but also all over the world, particularly against the Chinese communities, including there's been a couple of arrests made, I think, over the weekend of 2 perpetrators in the UK. Now, the UN Human Rights Commissioner has called on governments to prioritise tackling racism, and specifically in their responses to the COVID-19 crisis. So this is a really serious issue that is happening in a lot of places, and our solidarity goes out to anybody who's affected. Now, in this time of public fear, it is crucial, and I think trade unions can play a critical role in defeating any sentiment of xenophobia or racism and putting out a very clear stance against it. If you do witness a racist hate crime or verbal assault, whether in or out of the workplace, make sure to report it. You can report it to a hate crime reporting centre, and take steps to ensure the safety of any victim that you see, including calling emergency services, a paramedic if necessary, if you see a kind of physical altercation. Please reach out to your colleagues and make sure that they know that they're in a union that does not tolerate racism in any way, shape or form.
Yeah, it's important to remember, isn't it, that the COVID-19 virus doesn't discriminate against anyone. We're all affected equally. We've just got a few more questions on here, which we should have time for. So, can you explain the difference between force majeure and frustration of contract, please? This question comes from someone at the Musicians Union, where there are thousands of freelance members having work cancelled for the next few months. Can they enforce a claim if a venue chooses to close rather than is told to close by a public authority?
So in terms of force majeure and frustration of contract, these two are linked. So the force majeure, I don't even know if I'm pronouncing this right, by the way. I don't have a very good accent at the best of times. It's something written into a contract, like a clause in a contract, which specifically refers to the event of a frustration of contract. It's a bit confusing. It essentially excuses an organisation from their obligations should a cancellation happen which is out of their control. For example, a festival, a gig, a Broadway show or whatever. And an absence of that clause does not necessarily mean the organisation doesn't have to fulfil its contract, though. So it does, however, need to be out of their control. So if it's not a cancellation due to the law or due to Public Health England or the government or the local authority telling them they need to cancel, then there could be a case for you to claim. But this is an aspect of employment law that other union members may also be hearing. So it's not necessarily just musicians or those in the entertainment industry. For example, unions, including the British Dental Association, have been calling on respective governments to invoke force majeure clauses to drop the patient number in response to the patient number dropping. So fewer people are going to their dentist. As you can imagine, they're in isolation or they're worried about contamination. And this is affecting dentists' targets, and they're not being able to meet their targets. So in this case, unions are asking for it to be invoked. So you might hear that phrase being thrown around in quite different ways. But certainly musicians, the Musicians Union in particular, are asking members to complete a short survey so that they can keep abreast of what is happening with cancellations, and how they're best able to represent you. And we'll post a link to that short survey, but you can find it on the Musicians Union website. So if this is affecting you, do get in touch with the union. There might be a case for you if your event is being cancelled, but it's being cancelled as a choice by the organiser as opposed to them being enforced into it. But they are not, the Musicians Union is not yet offering a blanket advice on this, because contracts can differ so much, and I don't want to say that everybody's got a claim necessarily. And so the best thing to do is to make contact with your regional union office to get the advice that's relative to your specific contract or your specific place of work.
Great, thank you, Shelley. We've covered a huge range of questions there, and we've tried to group the questions together to make them more thematic. It's been great to see the number of questions that have continued to come in while we've been broadcasting. And as I said, we will try and answer as many of those over the coming days on the Ask a Question link, so keep checking back on this site. We will send you a recording, and we'll link to all of the resources we've talked about, and we'll include some of the really useful ones that have been posted in the chat panel. Dean posted a few minutes ago a link to a page from the Mind, the mental health charity, which has got a special information page about providing to support around coronavirus and your well-being. So there's loads of information there about how to support members and our own mental and physical health during this time, which is really quite unprecedented and is causing quite a lot of worry. So do keep a lookout in your emails tomorrow for recording of this webinar with details of everything we've covered and details about how you can continue sharing your experiences and your ideas with us, because we're really keen to follow this up in the coming weeks with more of the same. So it just remains for us to say thank you to everyone that's tuned in. It's been a really interesting webinar for us, and I hope it has been for you as well.
Yes, please keep in touch with us if there's any information in particular that you want to see. We're going to be doing more webinars because we understand that there's a big appetite for this, for people to be informed in the right way. So if you have any requests or ideas of who you might want to hear from, or what kind of aspect you might want to get a specific angle on, then just let us know. And as we've said at the start, we will be following up with all the questions in written form as well. So if you did post something, please don't worry, it will be answered. We just didn't have time for everything today.
Someone has just asked me where we'll be following up with the answers to the webinar. Underneath the screen, there's a little panel saying Ask a Question. Within that is where people can post their questions. We will post answers there also, and we'll post any links to further information from that panel. So hopefully you can all see underneath the panel that says Ask a Question. But thanks again for tuning in, and let's keep in touch.
We'll put stuff on the health and safety page on the TUC's website as well for anyone who wasn't in this webinar, if you want to share it with them.
Great. Thank you, everyone. Bye.